Okay, today we're going to practice entering some Salmonella lab reports, and then we will practice entering some Shiga toxin producing E. coli lab reports. And before we get started with the Salmonella, I would like to refer to Christy's PowerPoint presentation on slide 4 and slide 5. On slide 4, if you'll notice, they detected 3 different organisms. And on that particular slide, Salmonella was detected, E. coli, EPEC was detected, and the adenovirus. So if you get a report where it shows Salmonella detected on one of the GI panels, that case would need to be reported to DPH, and you would go ahead and begin your investigation for a suspect Salmonella case. On slide 5, you would notice that Campylobacter was detected and also E. coli EPEC was detected. So once again, you would go ahead and start your investigation for Campylobacter for that particular GI panel. So I did want to point those out before we begin our Salmonella lab entry. And then we will refer to Christy's PowerPoint presentation again throughout the lab entry, but not until we get to the Shiga toxin producing E. coli. So we'll go ahead and we will start with our lab entry up and open investigation. So if you'll follow me up here and click on open investigation, you can go over to the condition and click the down arrow. Once you do, if you will click on select all, that will unselect all of them, and then you can scroll down to the particular organism that you need. So for this particular one, we're going to select Salmonella oocysts. And if you click OK, that will bring up all of the particular patients that are currently in open investigation, or at least for the training field today. And if you go over and you click on patient, that'll put them all in alphabetical order if that's what you choose to do. So for today, we'll go down here and we'll just click on one particular patient, and we're going to go down here under Susie Q, and we'll click on Salmonella oocysts. Now, once you're getting ready to enter a lab report, you want to go up to the top of your screen to the far left under Manage Associations. And you'll get a white box that comes up each and every time, and it'll say message from web page. That's okay. Go ahead and click the blue box that says OK. And you'll see that they've already got a morbidity report entered for this particular patient. That's fine. We're going to add a lab report today. So click on the blue box that says Add Lab Report. Now, the first lab report that we're going to enter today is one from Diathorex. Frequently we get lab reports from Diathorex that will be reported as a Salmonella enterica, for example. So this particular reporting facility is one that we will have to search for. So you'll hit the blue box on the left side that says search. Type in Diathorex. Click submit. Okay, that one's not there. Or at least I don't see it by typing Diathorex, so we'll try one more time. I thought that that one had been added, maybe not. So if you run across this where you have a particular reporting facility that is not found, you can contact Terry Grimes or Mike Chardon to have that particular facility added. So if you have a hospital in your area, or if you have a reference lab such as Diathorex that needs to be added, that's who you contact. So for this example, we will pick a different lab, and we'll pick a hospital, for example. We can do Hardin Memorial if we need to. Okay, Hardin Memorial Hospital main lab, and you click select. Alright, so once you see that it's loaded in there, you want to go down and click your lab report date. So that's the date that the result has come in and that it was reported. So we'll go ahead and we'll just click today's date. Your specimen source is always important, whether it's urine, blood, stool, sputum, whatever the source is. So we're going to say this particular source was urine. Collected on the 1st. And then you go down to resulted test. Okay, so you can put in here Salmonella result. Now, when you go down to Salmonella organism, you're going to put in Salmonella enterica. That is usually always the type of result that I get from Diathorex lab. Occasionally I'll get a Salmonella enterica from other lab source, but that's usually the only result that I get from Diathorex. So then you would go down and you would add this test result. And once you do, you will see that result. Now, for some reason, if you get this result and you see that you've put it in an error, you can always go up and edit it, or if it's completely wrong, you can delete it if you need to. Now, if you're completely finished, you can hit submit. Now, I want to go ahead and take this opportunity to show you all how to enter a final lab from the state, for example. Because I find that a lot of local health departments, whether it's the nurse, regional epi, or environmentalist, do not know how to enter a final lab report. So if you're getting a final lab report from the state, you don't have to type in the Division of Laboratory Services. There's a quick code that you can use for that. You can put in DLS over here and do a code lookup. And it'll populate. Now, it does take a few minutes, just like you saw there. You can put in lab report date. So we'll say this one came in on the 1st. Specimen source. So let's say this one was a blood. Okay. Collected on the 28th. Resulted test. All right. Now, when you get one that's come into the state lab, we hope that it was an isolate that come in. So when you get an isolate that's come into the state lab, it's gone to bacteriology for serotyping. So we want to click Salmonella species serotype. And then down here under the organism, we want to put in that particular serotype. So let's say that you have a Salmonella typhimurium. Now, very important here that you don't click typhi, okay? There's a big difference in Salmonella typhi and Salmonella typhimurium. So if you have Salmonella typhimurium, make sure that you go ahead and get the entire word in there for typhimurium. Down here in the text result, this is where you would put the grouping. So typhimurium's group B. Down here you would put that it is a final result. And then down further where you have the option to track the isolate, yes, you want to track the isolate. And then was an isolate received at the State Public Health Lab? Yes, it was received. And then you put the date it was received. So when you look at your state lab reports, up in the top left, you will have a date and time flagged in. So that's the date that it was flagged in at the state lab. So if this particular lab was collected on the 28th, it might not have been received at the state lab until possibly the 1st. So then you want to put your outreach ID. On your state lab report, that would be your lab medical rec number. So that's going to be an 8-digit lab ID. So for the purposes of this training, we'll just put 1, 2, 3, 4, 5, 6, 7, 8. But once again, that's your lab medical rec number, and that's considered your outreach ID. So if this case was confirmed at the state lab, you would put yes. Was an isolate forwarded to CDC for testing or confirmation? We don't always know that, so I put unknown if I'm putting it in unless I know for sure that it was sent for testing at CDC. And then I add the test result. Okay? Now, what do you do, for example, if you have a serotype that you don't see in the drop-down box? You know, what do you do if it's not typhimurium, enteritidis, Newport? You know, what if it's kind of an odd serotype? So I want to show you how to search for that. So let's go ahead and try to put another one in so that I can show you how to do that. So let's go ahead and look here. Let's put Salmonella species serotype here. And let's look for one. So let's say we have a really odd one. Maybe we have Salmonella bovis formificans. Well, that one happens to be there, so maybe that one's not too odd, but it's kind of odd to say. So let's look for another one. What if we have Salmonella java? Okay, that one's not there. So what you have to do when you have one that's not there is you have to use your search tool, and you type it in like so. Click submit, and there it is. Click select, and it'll populate for you. Now you still have to put the particular grouping in, so go ahead and type out the group that's on your DLS lab report, text it in, and then go ahead and put your final status and your tracking just like we did with typhimurium, and add your text or test result just like I did for typhimurium. But since we already have one in there, I'm not going to proceed with that, so we can clear that. Now, if you have a result that comes in as a presumptive salmonella, up here, you can type salmonella result. Oops, it didn't clear that for some reason. Okay, so you would go ahead and put under organism, salmonella organism, and then under your text result, this is where you would type presumptive salmonella. So you can actually text in there something that doesn't populate for you, but that would be considered a final report if that's what your DLS report says. And then you go ahead and put in there any other comments that you might have on your report if it says referred to CDC or any other information that you need to put in there. Okay, so we're done with this particular example, so we'll go ahead and hit submit. Now, if you notice, it shows messages in red, and that's because I didn't go ahead and add my test result. So anytime you don't follow through with something on your entry, it will give you those messages. That's okay. You can go back, add your test result, and it's still showing me a red message. And that's because this particular field is empty. So we have to go back and add something here. So if you put salmonella organism in, that will be complete. Now, both those fields are complete and it should be accepted. Okay, so once that's been submitted, you will see the information that we entered here. So the first one that we entered was a Salmonella typhimurium. Then we entered a presumptive salmonella. So they're both in there, but once you've completed that, you still have to hit submit up in the far right corner, which is your middle button. Alright, that is all the information that we're going to add for Salmonella, because most of our training that I want to do today is going to revolve around shigatoxin producing E. coli, because that seems to be the most difficult test entry for the diseases that I cover. So we're going to go ahead and pause and get started on the shigatoxin producing E. coli. Okay, so now we're going to practice entering some shigatoxin producing E. coli labs, and we're back to open investigation queue, and we're going to go back up to condition and hit the select all button, and we'll need to go down and find shigatoxin producing E. coli. Click OK. Now, in the training environment, they don't have very many STEC cases, and unfortunately, they already have some lab reports in, so we'll just have to be patient while entering these. We'll go ahead and click on the first one, John Smith. Alright, now when entering a lab report, if you remember from Salmonella, we go over to the left side under Manage Associations. Alright, we're going to go down to Add Lab Report. Now, if you'll refer to Christy's PowerPoint on slide 6, there's a lab report from Lake Cumberland Regional Hospital Lab. And this particular patient was positive for shigatoxin 1 and positive for shigatoxin 2. So this case would need to be reported to DPH as a suspect STEC case, and that's the labs that we're going to begin to enter for this case. So we'll go up and we'll search for Lake Cumberland. We'll just put in Lake, see if we can search that way. Alright, I found it, so we'll click Select. It does take a minute to load. Now, we'll go down to the lab report date. Now, I believe that this is cut off for the PowerPoint, so we'll just pick a date for the purposes of the training today, and we'll click today's date. Specimen source. We'll choose stool. The date that it was collected, we'll go ahead and choose the first. Now, down here for resulted test, this is where a lot of the users get into trouble. I get a lot of calls because they'll call me and say, Tracy, I only have 2 options and neither one of them are correct. Or if they don't call me, they'll just put in the incorrect choice because they don't see the option they need and they don't know what else to do. So, if you remember from the report, it says positive for shigatoxin 1 and positive for shigatoxin 2. So, neither one of those options are here, so you're going to need to use the search field. Okay, so you have the option of a short list and a long list. Mike likes to use the long list. But let's look in the short list first and just see what your options are. And I like to just type in ESCH because that's a little bit shorter than typing the whole word out. Okay. Now, if you try the short list first and your option's not there, you can go back and use the long list. So, your option for positive shigatoxin 1 and positive shigatoxin 2, it's not there. So you can go down and click cancel and search again. Use the long list as Mike suggested and you'll probably find what you're looking for. Okay, now the issues that sometimes you have when you're using the long search is there are several options in there. Until you know what you're looking for, it's a little bit hard to find. So, on this particular page, I don't see what I'm looking for, so I'm going to need to hit the next button. Okay? Lots of options in here. Now, I do want to point out to you when you're looking at this, up here you'll see the options at the top where it says method and system. Your system where it says STL, that's stool, so at least you know if it was a source and it was stool. So that helps you to know one thing. So down here, we are looking for positive for Shiga toxin 1 or Shiga toxin 2. So we know that we're getting close because we see E. coli, Shiga-like. So that's pretty close to what we want. It might not be exact, but it might be the closest thing we find. So let's go on to the next sheet and see if we see anything else. Okay, we have E. coli, Shiga-like identified, but this is a culture. Now our lab report is not a culture, so that's not going to be an option for us. And then we get into the virotoxins. And then we get into other options. All right, so none of these are necessarily exactly what we need. So we're going to go back, and we're going to choose the E. coli, Shiga-like EIA, because that's the closest thing to what we need. So we click select, coded result, we're going to put in there positive, and then we're going to use our text result box, and we're going to type in Shiga toxin 1 and 2 positive. That way you know exactly what kind of report you got. And this is your preliminary report that you're getting from your local hospital. So you'll add that text result. Okay? So, granted you didn't have the exact thing that you needed in there, but that lets you know that you had a Shiga-like result and you knew that it was a preliminary result. Now, also, if you look at slide 6, you see that it tells you that they went on to do a stool culture, and it says no E. coli 0157 isolated. So, from that, you can go ahead and enter that result. So, you actually do have an E. coli 0157 H7 result that you can enter. So that's when you can go ahead and use this particular box, but not very often can you actually click on this box and use it, because most often you have more information that you're going to need to enter. So I'm going to tell you to try to avoid using this box unless you actually have a lab report similar to what we have right here, where you can put that exact information in. But since we have that information, this is one of those times when you can actually use it. So we have it. So on here, there's no E. coli isolated. So since it says no, we'll see if that particular coded result's in here, but I'm not sure if it's in the drop down box. Negative might be more professional, and that would be what I would choose to use as a nurse. And then down here I might put exactly what the report says. No E. coli 0157 isolated. And that's a final report. And I would add that result. So now you have both results entered. And you would always want to submit, because if you don't submit your information, it is not saved. Therefore, both lab reports that you've just entered would not be saved in the system. You always have to remember to submit your information. And then furthermore, you have to go up to the top right and submit it one more time, or it's not saved in the system. So click submit in the upper right hand box. Okay, now we're going to look at Christy's PowerPoint again, and we're going to go to her next slide, which is slide 7. And if you noticed on that particular slide, that particular panel has several different E. coli's, which Carol is going to talk about, I think, in her part of our presentation today. But I just wanted to point out one particular thing where it has the Shigella / enteroinvasive E. coli, where that's detected, because that particular one oftentimes gets reported as Shiga toxin producing E. coli and gets sent to the state and ends up in my queue to review. And I just wanted to let you know that the only one on this particular panel that would need to be reported to DPH would be STEC or 0157, which are right together, where it says Shiga and then it has STEC in parentheses and it has 0157 underneath it. So the ones that would fall under the STEC category would be any of the Shiga toxin producing E. coli's that are non-0157s. So those would be like 026, 0103, 0111. So basically, like I said, any of them that are non-0157. So I hope that that information is somewhat helpful to you. Now, we'll go on to the next screen or next slide. Let's look at slide 9 of Christie's. This is one from Quest, and you all get those as an ELR. So that is not one that I have in the training environment that I can show you as an ELR, but what we can do is practice adding one. So what we'll do is we'll go back to Open Investigations, and we'll pick patient 11 for this one. I know that you all are getting ELRs, electronic lab reports, from LabCorp, Quest, and some of the other outside hospitals or providers now. They're slowly trickling in. And the ones that are coming in sometimes as EIA antigens, and they'll show up as positive or they'll show up as detected. Those are antigen tests, rapid tests. They're not true cultures. So those would be suspect, but that's enough for you to begin your investigation, and you need to start as soon as that case shows up in your documents requiring review queue, or as soon as you get a paper lab report. So let's go ahead and start with manage associations once again, and remember, when this box comes up, you'll click OK. So if you notice on Christie's PowerPoint on slide 9, this particular one says Shiga toxin EIA with reflex to E. coli 0157 culture. Well, the good thing about that is Quest does reflex to culture. Not all laboratories do that. So we're very thankful that they still do. So let's go ahead and practice adding this lab report so that you all know how to put in an EIA antigen, which I think from the previous demonstration that we did, you know how to do that, but just in case. So let's search for Quest. Hopefully it's in the training environment. We found that Diathorex was not in the training environment, but Quest Adult Daycare is, but it doesn't look like Quest Diagnostics is. So our training environment may need to be updated. We will go ahead and choose a different hospital, but note that you can't just pick any hospital lab if yours is not in here. So once again, if your facility is not in here, you need to notify Terry Grimes or Mike Chardine, but just for the training purposes today, I'm going to choose a different hospital. So let's see if Callaway County, it may be Murray Callaway County. Let's look for that one. Yeah, Murray-Callaway County Hospital. Okay. So we'll go down and look at our lab report date. Now remember, once again, your lab report date is the date it was reported, the date it was resulted. That's important for us to know, because sometimes that helps us to know if they have performed a true culture or if it is an antigen or an EIA test. The source is also important for you to put in here, whether it's urine, blood, stool, sputum, wound, gastric aspirate, any clinical specimen. So make sure to put that in here. So let's say this one was a wound. All right. So let's say you have to go back a month. Make sure to use your arrows up here. You can use your calendar and click on that. I just want to make sure that I try to show you all the different features that you need to be aware of. Now remember, if you use your drop-down box, you're only going to get 2 options. So one of the options that you have is E. coli 015H7 antigen. Well, they did an EIA antigen, so you can use that, and your option is going to be detected. Now, under your notes, you want to make sure that you say reflex to culture. Okay? This, once again, is a preliminary result. This is not a final result. And we want all specimens to be sent to the state lab, whether it's Salmonella, Shigatoxin producing E. coli, and Stacy will go over that when she's doing her lab entry as well, because, you know, she needs her Campylobacter and Shigella isolates sent to the state lab for further analysis as well. They need to be serotyped in bacteriology. So once that's in, you'll go down to the bottom and click Submit. Okay. Now, let's move on to the next one. Now, if you go to the next slide that Christy had, which was slide 10, you will see one of the reports that we have from Diathorex. And this particular one from Diathorex is one of the good examples of an EHEC report. And that's typically what I get from them. If it is a Shigatoxin producing E. coli report, it will say enterohemorrhagic E. coli, and that's all it will say. And that's also what I see on some of the GI panel reports. It'll just say EHEC reported. Well, that's one of them that does need to be reported to DPH, because that would be considered Shigatoxin producing. So when you get ready to add that lab report, go over, add your lab report. Now, if you remember from the Salmonella, Diathorex wasn't in there, so we will choose another reporting facility today. So let's choose Ephraim McDowell. Let's see if that one's in there. Okay. Choose Select. And our lab report date. All right. Now let's say this one's sputum. Our specimen collection date. And like I said, once again, remember to use your arrows if you need to. And a lot of times there's a major lag time between the date of collection and the date that it might get to you, or the date it might get to the state lab. So it's really important that you look at your reports really well. Now, when you get ready to enter this report, you're definitely not going to have an EHEC result in here. So you're going to have to use your search tool. Well, I can tell you that EHEC is not going to be in your short list. So you're going to have to use your long list for this one as well. And once again, I just type out the 4 letters because it's a long spelling. Now, EHEC is not one that I remember being in here. But for the purposes of this training, we're going to look. And I'm not going to go any further than this, just to show you. So we're going to go back. Now, I don't see it anywhere in here. So what we're going to do is we're going to need to choose one of these to put under our report, and then we're going to have to text entry this in here so that the person who's interpreting it understands exactly what our lab report says. So it's similar to a rapid test because we know that it's not a true culture. So you can put it in under one of the E. coli results. So let's go in and pick the one that's closest to what we need. So let's go through these and see what we have. Let's look at the next screen one more time. So we're going to pick one that just says E. coli, okay? Because our result says enterohemorrhagic E. coli with EHEC in parentheses. Now, our report is whited out, but more than likely it's going to say detected or positive. So that's what I'm going to put in here for the purpose of the training. And then down here in my box, I'm going to put EHEC. Now, if you want to type out enterohemorrhagic, you can do that as well. And then this is definitely going to be a preliminary report. And then we're going to cross our fingers that they have sent an isolate to DLS for further analysis, and you're going to add that. You want to look at it to make sure it has in there what you need, and then you would submit that down at the bottom. All right. Now, I have one more example of a preliminary report that I'd like to show you how to add. And then I want to show you how to add a final report. So one of the more common preliminary reports that I get for STEC says Shiga-like or indicates the likely presence of Shiga toxin producing E. coli. So for that one, once again, you're not going to be able to use one of the 2 choices in the drop-down box. So you're going to have to use your handy search tool once again. So we're going to go to the long search. Okay. Now, your report says indicates the likely presence of Shiga toxin producing E. coli. So let's go to the next screen. Don't see anything that says Shiga toxin producing or likely presence. So let's go down here. Down here at the bottom, you're going to see the most likely candidate where it says E. coli Shiga-like EIA. So that's the one we're going to choose. And then coded result positive. And then once again, you're going to have to text your result in here manually. And my result says indicates the likely presence of Shiga toxin producing E. coli. Now, if it says STEC, you could put STEC in there if that's what you need to put, whatever your report says. And once again, this is a preliminary report, and you would add that result. But you get the idea that most of the time, these preliminary reports or GI panels are not going to be something exactly that you're going to see in NEDS. You're going to have to text enter the fields that you need and go from there. And then make sure you always click submit at the bottom. Now, what I want to do is add a final report from the state lab, because ultimately that's our goal, is we want isolates sent to the state lab for further analysis. We want them sent for serotyping and PFG analysis so that we can see if any of our cases are possibly linked to an outbreak here in Kentucky or linked to possibly a national cluster. So if you have a final report and it says E. coli 026, E. coli 0111, 0103, that's not going to be in one of those boxes. So once again, you're going to have to use your search tool. So you might get away with using the short list this time. Okay, so you can go with a Escherichia coli serotype result. All right, and then when you look under organism, go ahead, click your drop down box, see what you get. All right, you get the options of a Escherichia coli organism or 0157. So once again, you're going to have to use your search tool if you have an 026, an 0145, 0103, because your option's not going to be there. So use your search tool. Don't give up. Okay, so here you start seeing more results. Now, you can also see that someone has put an EHEC over here. So we could have went on further. I'm not sure how this ended up here, but someone's put it over here. So I guess if you want to put it in over here, you can, but that's not really a serotype. So, like I said, I'm not sure how it ended up here, but if you want to go ahead and put it in and go a step further, feel free to do that. But here are some of the serotypes that we have here. But we're going to look for an 026. So let's go to the next screen. Well, I don't see it here, so let's keep looking. Still don't see an 026, but we're not going to give up, okay? But as you see, we have many different serotypes of E. coli, not just 0157. There's many other non-0157s. All right. Still not seeing an 026. Here we go. Right down here at the bottom. 026, okay? Now, if your report had the H on there, then you would put that in here because it's not always going to be in the search field, unfortunately, okay? If your report has the Shiga toxin result, then you would put that down here. So you would put Shiga toxin 1 present. If it was Shiga toxin 1 and 2, then you would put both. And if this is from DLS, more than likely that's going to be your final result. And then as I taught you for Salmonella, yes, you're going to track the isolate. Was it received at a state public health lab? Yes. And the date it was received, that, remember, that's the date it was flagged in, which is in the upper left-hand corner of your report. So choose the date it was flagged in. And remember your outreach ID, that's the lab medical rec number, which is an 8-digit number. And that's how we identify our patients in an outbreak. That's how we keep their privacy. So make sure that you put that information in there. Was the case confirmed in a state public health lab? Yes. If we have that information, put that in there. Was an isolate forwarded to CDC for testing or confirmation? If I know that, I put it. If I don't, then I put unknown. And then I add that information. So there you have that. Very important once again to go to the bottom and click submit. Now, as you can see, we entered quite a few STEC results today under this one patient. But when you're in the training environment, if you're adding a patient and you want to practice, you can add as many as you need to until you're comfortable doing it in the live environment. If you have a question about entering a Salmonella or a STEC result, feel free to call me. The most common question that I get probably is Salmonella reportable. If it's from a urine specimen, yes, absolutely it's reportable. If it's from gastric aspirate, absolutely it's reportable. Any clinical specimen. So make sure to give me a call if you have any questions. My number is 502-564-3261, and then my direction is 4245. So I think that I'm done with entering my lab reports. Just make sure when you're done to click submit. That way all of your information is saved. Thank you.